Now to what could be a major breakthrough in the fight against cancer. We're very excited about this. In a clinical trial, patients' own immune cells were genetically altered to fight a deadly form of leukemia. One patient is said to be cancer-free after just 8 days of treatment. ABC's chief medical editor, Dr. Richard Besser, is here to tell us more about it. I know there's a lot of complicated science here, but can you break it down and explain it, how it works?
Yeah, I mean, this is pretty incredible. Using a patient's own immune system to fight cancer. Take a look at this animation. They had 5 patients with untreatable cancer. They used a virus to inject genetic material into a patient's own white cells to turn them into cancer fighters. Those then went out in the body and destroyed all the cancer cells. These patients, they all went into remission. 3 of them had bone marrow transplants and are doing great.
And we didn't realize one of the patients, and it hits home, our own David Aponte, who's a sound man at ABC. We have spent time with him, and it's just incredible.
Yeah, I spoke with David the other day, and you know, he credits this with saving his life. Last summer, he had lots of chemotherapy. He thought he was in remission, and his cancer bounced back. There was nothing left for him to do. He had this treatment. They injected the cells. An overwhelming reaction in his body. 8 days later, not one cancer cell could be found. He's had a bone marrow transplant. He's doing well. He's he's getting chemo, but he's on the road to recovery.
Right. And he's past the 100-day mark.
Yes.
That's the last time that we communicated. We're very excited. I remember when you did a similar story with Diane on World News. A precious little girl, Emma.
Unbelievable.
And so. Just describe how other cancers and how other people can be affected by this.
So Emma was treated. She was reported in December. She was the first patient with this type of leukemia to have this. She's in total remission, is doing great. But the idea is, depending on what you inject into these cells, you could target them to go after all different kinds of cancers. So the theory is maybe you would change them to go after prostate cancer or breast cancer. It's an endless approach. This study was a safety study, so they need to go forward, do it in more people, and figure out how do you tame this reaction, because it's basically creating a battle in someone's body, their own cells against the cancer cells, to see who wins.
At one point, could this be in lieu of having a bone marrow transplant?
Well, I talked to the researchers who did this study, and that's what they're thinking. They didn't want to go that way here. This is the first round. It's just looking at safety. But the idea is, if this wipes out all of the cancer cells, then why would you need to move forward and do a bone marrow transplant? Emma did not have a bone marrow transplant. But here for adults, where this cancer is only 40% survival rate, here, this is an idea that you might be able to treat and cure people with this disease.
This is so encouraging,
it's
so
very
promising.
Encouraging.
Nice to see you, Rich.